Hello, everyone, and welcome back to Sausage Links. Yes, it is called Sausage Links. This is a podcast where we talk about issues of self advocacy in a world that sometimes doesn't want to listen. The Self Advocacy Survival Guide helps those who are neurodivergent as well as in other forms of marginalization find ways to advocate for themselves in the midst of a world that tries to tell you that self care is the most important thing, but we're here to tell you self care is a load of bullshit. Welcome in. I am Jeannie V. I am one of your hosts. I am a transgender woman. I have shoulder length, auburn brown hair. Today I am wearing a halter style top that is decorated with red floral decorations and gold accents, my rainbow earrings, and some people say my very, very hot librarian look. And with me today is AJ Lacascio, my partner in crime, my cohort, my person who refuses to give up on me. Good morning, AJ.
Good morning. That is true. I refuse to give up on you. Never, never. As we're having conversations about sustainability and all of that good stuff for the organization, what a beautiful comment to make because it's true. I do not give up on my people. Um, so I am AJ Locascio. I am the founder and executive director at Umbrella ND. I am wearing a black sleeveless shirt, V-neck shirt. I have black and purple and blue hair, large geeky glasses and headphones, and I have a pouch around my neck and shoulder that has Widget, a gray and white Italian greyhound who is just doing all of the lovely heavy weight today as we begin this, what's going to be a pretty heavy conversation.
Yeah, and this one is probably going to be an extended conversation that happens over 2 or 3 different episodes because right now we in the United States are looking at a piece of legislation that has now become law, and this is a budgeting bill, a budgeting motion that came into effect on July 4th. And there's been a lot of conversation to the positive, to the negative about what this piece of legislation called the One Big Beautiful Bill Act is actually going to do for American people as a whole. Now, as this is a podcast dealing with neurodiversity and marginalization and people who are sometimes on the edges of care and trying to, take care of themselves in a sustainable way, this piece of law, this piece of budgeting from the federal government has huge implications. And so we're going to
Huge.
spend a
Yeah.
few days talking about this. So stay tuned with us. Please come back. We're also going to be dovetailing this conversation into another important conversation that will come after that. And that is going to be part of this financing bill actually cut funding to the 988 hotline, mental health hotline that the federal government had put in place. So we're going to be talking about the implications of that as well. Now, if you don't know anything about the One Big Beautiful Bill, this is a real quick, ugly, dirty. This is I don't know how to do this because
It's not simple.
no, it's not. But the hardest part of this is that when we talk about political things like legislation, laws, bills, this type of stuff, it is very easy to get into partisanism.
Hmm.
We try to step back from, some of the partisan positioning because we find neurodivergent and marginalized people in all spectrum of political viewpoint. The thing about the Big Beautiful Bill is that there are people on every side of the political spectrum who agree this is going to hurt people.
Yeah.
This is going to cause harm. From the nonpartisan oversight, you know, organizations, the federal government agencies that are responsible for looking at, what the federal government is doing with your money, because that is what funds this bill. Your tax money is what pays for this. So these oversight committees are looking at it, and this is a huge increase into the federal budget, meaning
Yeah.
that we are going to go trillions of dollars further into debt, because this will do so many different things that it is actually going to create a financial burden for the country. But the most pressing thing that we're here to talk about is the impacts on Medicaid, the federally funded medical assistance program, which there's going to be somewhere around $1 trillion cut from Medicaid over the next 10 years.
Mm-hmm.
We're also going to be talking about SNAP benefits, which used to be called food stamps. It is food assistance, which impacts almost 40 million Americans.
Yep.
So we're going to be talking about these issues. It will sound like we are being partisan, but we're not. We're actually only sharing with you what the provisions within this are going to do.
Right.
So please understand that if you feel like we're being partisan about this, we're going to do the best to try to present this in the most politically neutral way possible, to
Yeah.
talk about the impact that it's going to have specifically on the neurodivergent and marginalized communities of the people of this country.
Yep.
AJ, anything else you want to add
Yep.
on that?
I think it's important as we go through this to remember intersectionality,
Mm-hmm.
and that each and every person comes to this discussion with their own intersections. And as we go through this, we are trying to address those intersections and talk about how this will affect people in different ways, because depending on who you are, it might have a positive impact for you in one way and a negative impact for you in another way. Um, so it's really important to be able to look at that and understand that this isn't just about one group of people.
Yeah.
This is about all people and how we experience life in many different ways as we go through that life.
Yeah. One of the big takeaways from this is, as Angela said, there are going to be some benefits that some people receive from this.
Right.
But what we're going to be talking about is net. We're going to be looking at the net benefit or loss that a group of people are going to experience. Because whereas someone may not have, they may not be impacted in a direct way, it is very likely they're going to be impacted in an indirect way.
Right.
Especially when we talk about Medicaid, when we talk about SNAP benefits, those are not federally administered, those are state administered. Those come down to the states, and each state handles those a little bit differently. So we may be talking about something in one part of the country, but it will impact another part of the country as well.
Yep.
So buckle in. This is going to take a lot of time to dig in and sort of, get to the importance of how this is going to impact the people
Yeah.
that we talk to.
As we go through this, we want to give the facts, and we want to do that in a way that is accessible to others.
Mm-hmm.
We want to allow people some time to process what
Yep.
we're saying. A lot of this information that we have, we are going to also give a link to a document for those who want to read this information. That will be down in the description. And as well as when it's all said and done, we'll have a summary of what we talked about, and we will include all of the resources that we used to pull the information from today.
Yep. So,
all right, you ready?
Yeah. Without sounding like I'm trying to create fear or anxiety, the bottom line is this: somewhere around 12 to 17 million people are going to lose healthcare coverage.
Right.
Now this is based on the estimates coming from the government accounting offices. These are
Right.
people who are in charge of the budget. These are the ones who look at the federal budget. They look at how that money is distributed. These people are saying somewhere between 12 and 17 million people are going to lose healthcare coverage. Now this is in addition to the huge number of people, and I think it was somewhere between 20 and 40% of the population does not have any healthcare coverage whatsoever.
Right.
So we're looking at adding to that number already. So even if we go with a really nice conservative estimate of 12 million people losing healthcare coverage, we're talking about life saving, life extending, and quality of life improving Medicare, medical care that is coming to their lives.
Right. To people who would not have access to healthcare otherwise, because what this is really doing, the financial reality of this, is that we are taking wealth from the poorest people in our communities, and we are transferring that wealth to the richest people in the community. So, to put numbers to that, the bottom 10% are going to lose about $1,600 a year, which to some people, they're like, oh, $1,600, no big deal. It is a very, very big deal to a lot of people. And it's going to take that away from the poorest, the people who need it the most, and the top 10%, the folks who don't need that extra income, are going to gain $12,000 a year.
Yeah.
That's the financial reality. That's this isn't, again, this isn't partisan. This isn't we're not picking sides on this one. These are just the facts.
Right. This is the math. Right. This is the math that the bill actually builds up.
Yep.
We're not taking information out of the thin ether. We are actually looking at the bill and saying this is where the money is coming from.
Right.
And
we're going to give some specifics on that.
Right. When we look at the entirety of what's going to happen, when we talk about cutting benefits, when we talk about the removal of access to certain things, typically dollar amounts don't come into play automatically. But when we start talking about SNAP benefits,
yep,
food stamps, EBT, and we start talking about that could easily be anywhere between $50 and $100 a month that goes into that budget for that household. That over 12 months, that is now $600 to $1,200 that family loses.
Right.
When we talk about Medicare, when we talk about the medical assistance that Medicare provides, we're talking about medications that are typically, co-paid at maybe $5, and now they're going to have to start paying $25 a month.
Yep.
We're talking about this in very practical home
physician going to the doctor's office and having to pay a $35 copay to see the doctor. And these are for people who actually are they still have Medicaid.
Yes.
They're still qualifying for it. But now they're paying $35 for a doctor visit. And this is a family who maybe makes $24,000 a year.
Right.
And they're paying $35 and they have a chronic illness. So they see doctors often, or have to go to urgent care or the emergency room often.
Yeah.
Or maybe there are several people in the family who have to see doctors. And every time now it's $35. That adds up very quickly.
And we want to add in this very important part of this. Because of what this bill, what this budget does, we are looking at, in particular, rural and inner city medical care providers being shut down.
Yeah.
We're I lived in
They're losing the funding that keeps their clinics open.
right. I lived in the
Or
Oklahoma
hospitals.
Panhandle for 10 years, where there was one main hospital and some smaller county type hospitals, but there were still only 3 or 4 of those. And the main hospital was going to close when I was there because the funding was no longer available. Now we're going to see that in a more widespread, you know, experience in areas that are absolutely already struggling to get quality healthcare providers. Doctors are leaving the states because they can't afford to do the work.
Right.
And so we're looking at rural areas, especially, and this is going to be the biggest hit on areas such as the South, where they rely on clinics, where they rely on rural hospitals to handle most of their medical care. And those places are not going to be available anymore.
Right. So a pregnant woman now is going to have to ride in a car or drive or
Yeah.
however she's going to get there for 90 miles, 100 miles,
Yep.
Rather than being able to go somewhere closer to home.
Right. We're also
um,
going to see the downstaging of critical care hospitals.
mhm.
They are not going to be able to sustain critical care status. And so, if someone has a significant medical event, they won't be able to go to a regional hospital. They will have to be air flighted or ground transported to a critical care unit in a larger city, which adds hundreds, if not thousands, of dollars to a medical bill. And in many
Oh
cases,
yeah.
flights are not covered under typical
Yeah.
insurance. Some
Thousands, if not tens of thousands to a
right.
medical bill.
The
Yeah.
average Metaflight for a critical care incident is, I think, $14,000 to $18,000 for a flight,
Yep.
and that is not covered under your typical medical care coverage.
Right.
So when we're talking about how this is going to impact households, almost every household under, I think it's like what, $250,000 a year income, almost every household is one medical emergency away from financial bankruptcy.
Right. I mean, we've seen it time and time and time again. In
Yeah.
fact, um, some of this information, it's really easy to know what's going to happen because there were Medicaid cuts in the past,
Hmm.
and when these Medicaid cuts happened, it was a disaster.
Right.
And yeah, exactly. We lost hospitals, we lost lives.
Yeah.
Right? That's the ultimate reality of this is lost lives.
Yeah.
Unnecessarily lost freaking lives.
Yeah. And when we talk about Medicaid and how that is handled at the state level, 40% of rural children, kids who live in rural areas, are covered by state medical assistance funded by Medicaid.
Right.
Now, your state may call it something different. It may be some kind of name that whenever you go to take your kid to the doctor's office, you provide them your benefit card for your kid. That is impacted by this
Mhm.
because that money, that Medicare, Medicaid money, is what pays for those kids. 40% of kids in rural America are impacted by this.
Yeah. Which means their community is impacted by this.
Exactly.
Right? And if their community is impacted by this, your community is impacted by this.
Yep.
Because community, it just keeps extending out and out and out.
Mm-hmm.
Whether we know those people, whether we interact with those people, we are one huge community. And what impacts one member of our community impacts every member of our community.
Yep.
So let's talk for a minute about, let's say there's somebody on here and they are making, $85,000 a year. And they're like, but wait a minute, I was told that I'm going to win
Mm-hmm.
on this. So first, let's look at those people who make a lot more than that, hundreds of thousands of dollars a year. The major wealthy, the top 0.1%
Yep.
of earners are going to gain $290,000 or more per year.
Right.
Okay.
And let's very quickly, that $290,000 is realized in their income, their regular paycheck income, because
Yes.
the tax that they have to pay on that income is reduced.
Right.
So they are getting more in their paycheck.
This is money in their hands.
Right.
Right. This is money in their hands. And that's the top 0.1%.
Right.
They don't need that money. They don't need that. The top 20% are going to have an annual income increase of $13,000.
Yeah.
Okay. So while we've got 40% of children in rural areas losing every benefit that they have,
Mm-hmm.
the top 20% of earners in the United States of America are going to have an additional $13,000 cash in hand.
Right.
And this is because business tax cuts.
Mm-hmm.
There are going to be deductions for sales tax and
Mm-hmm.
all of that good stuff, and then estate tax cuts.
Yep.
So these tax cuts are going to impact the wealthy in ways that they would love to be impacted.
Right.
It's
Exactly.
going to help them. It's going to help them. And they're not taking that money and putting it back into the community to support
Yeah.
those who are losing benefits. So now let's talk about that family that makes anywhere between 53,000 to 96,000.
Mm-hmm.
Those families are going to, on average, have $1,430 extra
Yeah.
a year. They're going to gain that. However, if they are rural middle class,
Mm-hmm.
they are going to suffer when the hospitals close and the clinics close.
Mm-hmm.
If they're disabled middle class, when the community benefit services go away, they are losing big time. And
Yeah.
here's what I mean. There's a thing, it's called HCBS. Okay. This allows elderly, disabled folks to stay in their community. It allows them to receive services at home so that they can live independently
Mm-hmm.
while also receiving the care that they need instead of being institutionalized.
Right.
So in the 80s, this was not it. I'm looking at like 1982. I know I have a chart in front of me somewhere, but I remember this. In like 198, I said 1882. I meant 1982. 1982, we had 100% of the funding going into institutions
Mm-hmm.
because that was the only care that somebody could get.
Right.
Fast forward to 2012, we now have 65% going into the community
Mm-hmm.
because people are 65% of these folks are now able to live in their communities independently
Yeah.
with some support.
Mm-hmm.
That's freaking awesome. That's what we want,
Yeah.
right? And this is great. If HCBS goes away, those people now are dependent upon institutions and have to go back to institutions. By the way, institutions that don't have space for them
Right.
and are not getting funding to support them
Exactly.
because these are getting defunded as well.
Yeah. Now, when we talk about, when we talk about that shift from institutional care to the home community, how does that directly impact neurodivergent, disabled, and other individuals in terms of the real world impact? What does that look like?
Well, I mean, the real world impact when you get taken out of your community is an exponentially decreased quality of life.
Mm-hmm.
And as quality of life goes down, we see suicide rates increase,
Mm-hmm.
which is why we brought up the 988 crisis line because this is happening simultaneously.
Yep.
We see people's health deteriorating,
Right.
and their health is deteriorating and they don't have access to care.
Yeah.
So they die. People die.
Right.
Okay. And especially when we remember that neurodivergence is much broader than a lot of people think it is. A lot of people think it's autism, ADHD, perhaps some learning disabilities. Um, but it's really, you can go on brainfacts.org or you can go to the National Institute for Neurological Disorders, NINDS, and you can look up the 400 different conditions that affect the brain and the nervous system. Those are all neurodivergencies.
Right.
Okay. So, cerebral palsy, MS, epilepsy, uh, traumatic brain injury,
Stroke.
stroke. Thank you. Let's talk about stroke for a minute. Stroke is something that affects Black women in a different way than it affects others, and it's not discussed. And we have these high rates of Black women who go in to the hospital, they have a stroke, and they don't necessarily receive the care that they need because there's not culturally competent um, folks who are in there taking care of people who are aware of maybe some specific needs. Who, if you have a Black woman who goes in who has had a stroke, and maybe this doctor is culturally aware and specifically aware of the impact on Black women, and so they're able to do things more quickly to provide the medication that is needed, to provide the care that is needed, so that this woman is able to fully recover
Mm.
after the stroke. That is less likely.
Yeah.
We've got lots of information from the American Heart Association on this. Um, and so this is what we're talking about when we talk about neurodiversity and intersections,
Uh-huh.
because now we have this neurodivergent Black woman who is already losing benefits because she lives in a rural area.
Uh-huh.
She didn't get the care that she needed from the ambulance staff because they didn't know the specifics that they needed to know for Black folks. and she gets to the hospital too late to receive the medication that she needs, because there's a window on that,
The golden
right?
hour.
There's a window on that. So, and you can talk about this because you've done this job.
Mm-hmm.
You've done this job, and these people, I hate to talk about fairness, but it's not fair.
Right.
It's not fair to take more away from people.
True.
It's just it just sucks.
Yeah, it does.
I'm getting emotional over here because tax cuts, the tax cuts that are benefiting the wealthy, flat out does not compensate for the loss of healthcare, food assistance, and fucking life that is happening because of this.
Right.
Yay, you're getting tax cuts. Good for you. Good for me. I'm getting tax cuts because I'm in that,
Mm-hmm.
middle class and I don't live in a rural area.
Yeah.
So yay, cool. I'm going to be getting an extra 1430 on average a year. Yay me.
Mm-hmm.
I don't want that. I
Right.
want people to live. I want people to have access to care.
Yeah. And this is the sad realities of all of this. Politicians were aware. Politicians were aware that these pieces were a part of this legislation.
Yeah.
There were a group of politicians who came out and said, no, we cannot support this because it is going to impact our constituents directly. And then turned around and voted for it.
Yep.
So we are talking about this. The passion, the emotion is there because this was a willful choice on the
Yep.
part of the people that we have elected to represent us and our common welfare. The common welfare is the job of politicians. The general welfare is actually what it says in the preamble to the Constitution. So when we talk about this, we talk about this from a position of this is in place through a set of willful choices that
Mm-hmm.
elected officials made. And so now we, as advocates, we as activists, we as individuals who are doing our best to help you, the audience, care for yourself the best way you can, we are taking this time to help you understand you are going to be impacted
Yeah.
because of the choices, the willful choices of other individuals. This is the very foundation of self advocacy. When others make willful choices about your life, you have to take a stand for yourself
Mm-hmm.
and begin to advocate for yourself.
And advocating for ourselves means advocating for our community.
Yes.
Because folks, let's face it, people are exhausted.
Yeah.
People are so tired right now that they're switching off. They're like, I'm done. I'm not watching the news anymore. I don't want to know what's happening. Let me know in 4 years when all this is over. Um, I'm never voting again because what does my vote matter? I feel exhausted. I'm defeated. This is how people are feeling right now.
Right.
And when your community feels that way, that affects you.
Mm-hmm. Yeah.
Anybody who's worked in a workplace that has poor morale knows what it's like to be in a community that is suffering. And let's face it too, a lot of our communities know what it's like to suffer.
Yeah.
And that suffering of some members of the community equals suffering for the entire community.
Mm-hmm.
And self-care and self-advocacy can really only happen through community care and
Yes.
community advocacy. There is no self-advocacy without community support.
Exactly.
So when we say the self-advocacy survival guide, in front of that, we say community supported self-advocacy survival guide. Okay, when we say, as Judy said in the beginning, because we love to say this, when we say self-care and self-advocacy is bullshit, we mean it's bullshit when it's in a vacuum.
Mm-hmm.
When you're expected to pull yourself up by the bootstraps and make it happen, because that's the American dream.
Yeah.
I don't know why I did that voice, but whatever.
That's the American dream. Thank you for coming to our TED Talk.
Hi, Widgie. Hi, babe. What happened to you, Mom?
I've always seen a disturbed widget. Oh my God.
You know, let's dig into this a little bit more.
Okay.
How are lives threatened? What is this big, beautiful bill? What is it really doing? One, there are new work requirements. And these work requirements say and this is direct, able-bodied adults between the ages of 19 and 64, unless they are parents of children under the age of 14, they must work or volunteer for 80 hours a month.
Yep.
If they don't do that, they don't get benefits.
Yep.
Okay. Eligibility checks are now going to be every 6 months instead of annually. Higher copays, as I said earlier, $35 for medical services. Also, right now, somebody who has a medical disaster of some kind, and maybe they've lost their job, their child needs to have surgery, and they need insurance and they need it like now.
Yep.
But they are neurodivergent and it took them a while to get some of the stuff together, and they needed some help. And their sister, who usually helps them with this kind of stuff, is out of town. So they have to wait until she gets back in town. And then they can start filling out the paperwork. And it didn't get filled out correctly the first time because they left a spot blank or they forgot to put their signature on there. They didn't read it correctly, whatever the reason. If you know, you know, because I don't know about you. I've done all of these things.
I'm going to have to go take something because you just drove my anxiety up about 8 notches. So
I'm sorry. And I know this is something that we've talked about is, how difficult it can be just to fill out a form and get it turned in.
Yeah.
So now retroactive coverage used to be 3 months. So let's say it took 3 months for you to do that. You've just been piling up the bills.
Yeah.
Retroactively, they'd be able to take care of that. They're going to reduce that to just 1 month.
Yeah.
This is significant for a lot of ND folks.
It is.
This is significant for a lot of disabled folks who can't get to the office, right? If anybody has tried to call the office lately, I know I have because I help my mom with things, cannot get through.
Yeah.
Cannot get through, and it's been months, and you have to get in the car and go to the office and wait there. There are a lot of disabled ND folks who that's not an easy thing to do.
No, it isn't. Between mobility issues or anxiety, agoraphobic issues,
living in a rural area,
living in rural areas,
not having transportation,
inner city areas.
Yep.
and also slashing the hours and the active employees in those offices that you have to go to.
Mm-hmm.
This is what
Mm-hmm.
is a recipe for disaster.
Right. Right. And I'm sorry, but we have to continue this conversation because I talked about the community-based services
Mm-hmm.
before that, HCBS. Again, this is huge. This is about independence. This is about being able to be active in your community.
Mm-hmm.
This is about autonomy,
Yeah.
self-determination. Okay? This is an optional Medicaid service that right now is active. The point of the program is to help us stay in our community.
Mm-hmm.
Okay? For, okay, if you have a frail and elderly waiver, say, somebody who's watching this right now could have a frail and elderly waiver, meaning that they need extra supports to do their laundry, to take care of their house, to drive them to appointments, maybe record keeping, all of these regular activities of daily life that people do.
Mm-hmm.
Okay, they need support. They are at risk of losing this quote optional service. How the hell this is optional, I don't know, but whatever.
Right.
This is one of the optional Medicaid services that they're looking at cutting first.
Yep.
Employment services. They want you to be working 80 hours a month, but
Mm-hmm.
they're going to freaking cut the services for disabled folks.
Yep.
Yeah, that recipe for disaster right there, being set up for failure right there.
Mm-hmm.
Personal care attendants, those people who come into your home to help you do your dishes, and maybe this person helps you take a shower
Mm-hmm.
and get ready for work,
Mm-hmm.
and then they drive you there.
Yeah.
Nope, sorry, not gonna have that anymore. You were gonna say something, I know it. I saw your body language.
I so if we remove the ability to access employment, that would only leave one arena of fulfilling this requirement, and that is unpaid volunteerism.
Mm-hmm.
So essentially, you're losing benefits, you're losing coverage, and now you have to work for zero.
Yep.
That is going to be even more of a burden on an already overburdened, under-resourced household.
Absolutely.
It says parents with children under 14, but I mean, what are we doing with 14 to 18-year-olds? What are we doing with that age group that the parent doesn't need to supervise them?
Right.
But isn't it convenient that they are lowering the job requirement age limits to 14? We are not dealing with partisanism on this. We are looking at this from the bottom up, not the top down. This is not about the parties. This is not about liberal, conservative, progressive, traditionalists. We're talking about how does this impact a household where if you have a neurodivergent person in that household, And there is evidence to say that that neurodivergence can also manifest itself in your offspring.
Hmm.
Now we are looking at that household being told the only way that you can get help, the help that you've had, the only way you can get help is that you and your kids, starting at 14 years old, must work, but you may not get paid for those jobs.
Right.
There is a word for that in the English language. It is not a pretty word. It is not a word that we should use lightly. But when you force someone to work with no real compensation for that, at the bare minimum, it's called human trafficking. This is a willful choice to let this happen in the United States.
And again, I'm going to say this has happened in the past.
Yep.
Okay. This isn't the first time it's happened. When Medicaid funding drops, the first thing that happens is disabled folks lose their independence.
Yep.
I'm going to repeat myself. When Medicaid funding goes away, disabled people lose independence first.
Mm-hmm.
Excuse me. Okay. This says disabled people who have been living in their community, they have been able to meaningfully participate in their community. Now they are being forced to move back to nursing home care.
Mm-hmm.
And that is not cost effective for the community.
No, it isn't.
Nursing home care is a lot more expensive
Mm-hmm.
than when funding is able to go to home and community-based support.
Right.
Again, we have proof of this in the past. That link is going to be in here. People can go and they can go look at it. Okay. We talked about this before. 65% of long-term care spending goes to HCBS
Mm-hmm.
in 3 years ago.
Right.
Okay. We want that money to go there because it stays in our community versus going directly to an institution that is poorly regulated,
Mm-hmm.
where people receive poor care,
Mm-hmm.
right? Because if you don't have a lot of money, it's not like you can choose to go to one of these nice facilities that has a golf course.
Right.
I remember my little sister years ago. She was young. We drive by this really nice independent living community. It has this huge golf course. I think she was like 14 or something. And she's like, that's where I want to live when I grow up. It's not those kind of places that
No.
people necessarily get to go to. Okay.
It's the places that are on your 5 o'clock and 6 o'clock news that were being investigated for abuses.
Right.
It's those facilities where embezzlement is common, where the money that is coming in as a form of assistance is actually being funneled to administrators, and the care is not going to the patient level. It
Right.
is the locations that are being shifted from government sponsored to for profit
Hmm.
owned. We're
And guess what?
seeing
They're not in your rural communities.
right. This is why this is the exact same thing we are seeing with prisons. It is too fucking expensive to run a prison.
Hmm.
So the government is getting out of the prison business and looking to get for profit private prisons to replace it. Same thing with education. Look at the states that are trying to get rid of public schools and go to school vouchers that help pay for private schools.
Yep.
So we're looking at moving people from community based, home based healthcare, where they see the most benefit, shifting back to an institutional care that is not going back to federally funded, but instead will be private and for profit funded.
Hmm.
We're not going to see a rise in the well being and the overall wellness of people
Right.
when we make this shift.
Yep.
Now that is, I mean, this is the reality that we have to deal with. That's what we have to do is we have to deal with this reality that is now ours. We can talk about the past, we can talk about the future, but right now, what do we do? What do we do with the right now?
Yeah.
Planned Parenthood is being defunded.
Yep.
And Planned Parenthood is the most accessible medical care coverage for impoverished and lower income areas within states. And that is being defunded, and those are being shuttered. Mostly because of a hack job promotional campaign that says that Planned Parenthood is all about one particular type of medical care. But the reality is they provide general medical care, including vision and dental in some places, for those areas that cannot get a clinic, that
Hmm.
cannot get a private practice established. Rural areas are going to be impacted on large scale because this is the idea, this is the understanding that if you live in a rural area, you're used to traveling not by miles, but by hours.
Hmm.
When you live in a rural area, it's like it's a half hour to the grocery store.
Yeah.
It's 2 hours to a Target, which we're not going to Target anyway. But we in
A
rural America,
pharmacy.
yeah, a pharmacy. It's going to
So
be a
you
45
have to,
minute.
let's look at this scenario. You have to drive for 30, 40, 50 miles to go to the emergency room.
Mm-hmm,
And then you can't pick your medication up from the pharmacy
mm-hmm.
until tomorrow.
Yep,
So now you drive home and then you drive back,
yep.
right? This sucks.
Yeah,
It's
it does.
it's
It does.
it really does. So let's talk about births. 40% of all births are covered by Medicaid.
Mm-hmm. 40% of
40%.
births are covered by Medicaid. The cost of a birth in a hospital facility
Hmm.
is tens of thousands of dollars. This is why we've moved to it's a drop and go kind of setting anymore. Used to be, you take 3 days to a week after delivering a baby to recover. Now 3 days is tops. You're done at 3 days, and
Right.
that's insurance paid.
Right.
If you don't have insurance, you're dropping that kid, and if you can walk out of the hospital, you're going. Now, in predominantly Black demographic areas, populated areas, the mortality rate is already significantly deadlier. We know this. We know that there are more infant, newborn death within Black populated areas. If we see Planned Parenthood, if we see 40% of these that are covered by Medicaid, if we see these areas that are rural, or they are inner city, or they are in a marginalized area, if we see those numbers going, the coverage going down in those areas, the only thing that we are going to see on the backside of that is mortality rates going up.
Right.
This is why people are so passionate about Planned Parenthood. It's not one particular type of medical care. It is the entirety of medical care that some people get. It is the complete medical care that they can have access to.
Yeah.
The idea that Planned Parenthood is associated with one form of medical care needs to be eliminated. Because when those go, that medical coverage goes. There's no care provided at that point.
Right.
We already know that food deserts exist in marginalized regions, rural areas, urban areas that are typically dominated by Black and brown communities. We know food deserts exist. And now we know that medical deserts are already existing. We already know that there's going to be those experiences. But with these being shuttered, those are only going to expand.
I have to expand on the the maternal mortality rates,
Mm-hmm.
because the most recent data is celebrating that there is a decline in maternal mortality rates
Mm-hmm.
for everyone except Black women.
Mm-hmm.
Okay, so white women went from 19 deaths per 100,000 live births to 14.5.
Mm-hmm.
Latina women went from 17 to 12.
Mm-hmm.
Asian American women went from 13 to 11. Black women had 50 deaths
Yeah.
for every 100,000 live births, which is up from 49.5.
Yeah.
Cuts to Medicaid are going to bring these numbers back up.
Mm-hmm. Yeah.
And it's hurting the most marginalized members of our community more than it is hurting anybody else.
Yeah.
And this is not okay.
Exactly. Now, these impacts are when we start talking about the numbers that are impacting, when we start talking about the numbers impacting kids, when we start talking about the numbers that are impacting the Black community, understand that those numbers reflect also what's happening with the LGBTQ plus community.
Absolutely.
Because the statistics are pretty much across the board in those marginalized groups, right? When we start talking about those marginalized groups, all three of those areas are going to see about the same impacts. So when you start talking about a minor who happens to be Black and lesbian, they are the ones who are going to take the biggest hit.
Yeah.
Throw in neurodivergent in the sense that maybe they have autistic traits, or maybe they do have a neurological disorder. That only compounds what is happening to them on the day.
Or they have complex PTSD, which makes them neurodivergent because of these various intersections and the various traumas that they've experienced on a regular basis because of these intersections.
Right.
And that changes the brain.
Mm-hmm.
It takes a lot of energy for that person to live every day.
Yeah.
And that person doesn't have a safe place to call.
Exactly.
Because the 988 Lifeline LGBTQ plus services go away next week.
Yep. Yeah.
And that's what we're going to talk about next time as we continue this conversation.
Right. Well, we haven't even gotten into what the SNAP benefits has done. And
Right.
we are already at the hour, so we do have to provide some form of wrap. But it's kind of hard to leave the conversation where we are right now, because right now it's like, okay, well, we have done a really great job of bringing everybody down to the absolute lowest that they could possibly be. But no, we haven't.
Right.
What we have done is we have provided information on the situation that we are in. But when you are informed, you now become powerful.
Yep.
It is so easy for us, and there's a lot of people who are just ready to crawl into their shell and say, we're done. But we aren't.
Right.
This is where we become empowered, because now we can inform ourselves. Now we can see everything laid out.
Yep.
We have seen politicians who have tried to do the backdoor stuff. They have tried to hide things. This time they didn't.
Right.
Politicians didn't hide anything this time. They were bold, they were out front, they were loud, they were proud, and they were ready to say, yeah, we know this is going to hurt you. We don't care. At that point, you are now empowered to look at them and say, you don't represent me.
Yeah.
I know political action is so overwhelming, and it is so tiring, and it is so sometimes defeatist in its understanding. But this is not the end. This is not the final nail in neurodivergence and marginalization when it comes to this country.
Right.
We are not stopped because of this. We become more powerful when it is this kind of situation, because we move into a place where we begin to realize we don't do this with solo and siloing. The only way we do this is by getting together and lifting one another up and supporting one another and carrying one another and looking at one another and saying, hey, look, I can't do this, but I can do that.
Yep.
You can't do that, but I can do this. So now we share in the resources that we have together. We were talking, the great example of this. Okay. We don't have access to a pharmacy. Well, hell, I've got to drive 30 miles into my job every day anyway. So why don't I go ahead and pick up your medicines at the end of my shift and I'll come back and drop them off at your house? But I'm going to have you help me with something because I can't make this phone call. Could you make this phone call during the day?
Yep.
We begin to look at what we can barter in terms of our abilities, not our disabilities. Because even in our disabilities, sometimes we have ability.
Yeah.
In our disabilities, the things that limit us. There are some people who are agoraphobic and they cannot go out because their social anxiety is so overwhelming, but they've gotten really fucking good at the internet.
Yeah.
And there's another person who's like, I've got to go into work and I can't do this thing. I can't research this thing. So what can you do this thing while I'm doing that thing, and I'll do this thing because you can't do that thing. And we barter out of the abilities that people tell us are our disabilities.
Right.
And we look people in the eye and we do not feel ashamed.
Or we don't look people in the eye and we don't feel ashamed for that either.
Exactly. But I am a transgender woman who experiences complex PTSD, ADHD, depression, anxiety. There are days when I struggle. There are days when, hell, yesterday I was looking at the news and I'm like, fuck it, I can't do this. Yesterday was like, I'm not shaving, I'm not doing makeup, I'm not doing hair, I didn't go live, I didn't do the things that I normally do because I could not. So yeah, we do that, but we don't do that with shame. We hold our head up and say, yeah, this is the stuff that happens in life. Mm-hmm. We acknowledge it.
We don't have the energy for shame.
No, shame is too much of a suck.
Yeah, it's an energy suck, and that energy can go elsewhere.
Exactly.
And everybody is a self-advocate.
Yeah.
Everybody is able to participate in advocacy.
Yeah.
In one way or another. It might be sharing a post. It might be starting a conversation. It might be learning some new information, or it might be standing outside in the sun for hours holding a sign, during a rally, because that's important and it's happening, and that person has great fun doing that.
Now,
yay.
Here's a great example of two people doing the exact same thing in two totally different ways. I go on TikTok and I get loud and I get very in people's faces and say, this is what's happening. This is what is real. But I go in public, I'm not as loud. Mm-hmm. My good friend, Tori, doesn't go live very often, doesn't get on here and do all of this stuff. But by God, we would go to the bar and she would ask people why they're supporting a fascist, not in a casual table voice, but why are you supporting a fascist, so that the whole damn bar could hear. Mm-hmm. We do what we are able in the face of what people say is our disability.
Right.
And we use that power to stand up and say, no, you're not going to do this to me. You are not going to do this to me. You made a choice about my life, and I'll be damned if you get to take my choices away from me. Right. And that's power.
Right. And we are resourceful as hell as a community.
Yes, we are.
We really are. And when Sausage comes out and you're actually able to get your hands on that book, it is going to have lots of different practical ways that folks can advocate, that folks can do something. But I want to leave here today giving some practical things that people can do. And so I'm just going to kind of go down a list here of, here are some things you can do. Document, document, document. Okay.
Mm-hmm.
Every time you get a letter, every time you get a change or a denial on something that has to do with your care, document it. If documenting things like that is difficult for you, ask somebody to help you so
Mm-hmm.
that it gets done.
And
Screenshots.
yeah, that's what I was getting ready to say. Screenshot, take a picture of it with your phone, put it into a Google Drive or something that is online.
Mm-hmm. Yep.
It's nothing, it does not have to be complicated. It does not have to be, this idea of, well, I need to scan this, I need to fax this, I need to do something that is 20th century technology. No, we're 21st century babies. We can do this.
Yep. Absolutely. Share your story. Send it to me. Send it to my email. Let's see. Is my email on here? I think it is. How is my email not on in our little banners? Okay. Info at umbrellaopensdoors.org.
Info at umbrellaopensdoors.org.
Yes. One more time. Info at umbrellaopensdoors.org. You have a story you want to share? Record it, send it to me, write it, send it to me. Let's make it happen. Let's start sharing these things so people are seeing the real impacts that are happening.
And right now, more than ever, if you have the inclination, do a video diary
Oh
of your
yeah.
care and how it
Or a
changed.
voice, you can record your voice.
Yep.
Lots of different recording options. I love otter.ai. You can get a free account that has, I believe, 600 minutes a month on their free account. It's a great, I use it all the time for everything. That's why Jeannie made the face when when I said that. Okay, know your rights.
Yes.
These things are not changing right this minute. They're not changing until 2026. So you have some time to get things prepared. And of course, this conversation is going to continue
Mm-hmm.
because we are overrepresented in this because so many of us need Medicaid support. So we have time to prepare together.
Yep.
There are exemptions for disabilities, caregiving, and pregnancy. Know what those are.
Mm-hmm.
And if you get a denial or you get a cut and you're like, this is not appropriate, appeal it.
Yep.
Get some help. Let us know. If you don't know how to appeal stuff, let us know. It is going to be different in states. It's
Yep.
not going to be exactly the same for everyone. But let's start putting together some resources. You have a great resource in your community that helps people understand this information and know their rights. Send it to me. I'll put it on our website so
Yep.
that other people can access it. Okay? There are lots and lots of things that we can do. We are going to continue this conversation. We are going to put these how can I's down in the description of this. We're also going to give you full access to this document that we created that kind of has our talking points on it. We're just going to give you the whole document. Here you go.
Yep.
And let us know if you want to be part of this conversation. You've got my email right there. Let us know.
Yep.
Because that's what we're here for. Brainbow Media is all about giving you a platform for you to come in and advocate.
Absolutely. AJ, this was going to be tough. It was going to be hard. It was going to be emotional. We knew that. And it's going to continue to be so. But I look forward to the next episode.
I do too. I wish that it was like right now. Okay, y'all, next Tuesday, 9 a.m., we're going to be back here to have this conversation. If you have something that you want us to share before then, you've got my information there, info at umbrellaopensdoors.org. That will get that information to me. And in the meantime, get on here and watch what's happening with our health equity series, because holy moly, just last week it was amazing. We had some really great conversations happening on there, specifically dealing with being Black and neurodivergent and having access to um, culturally appropriate care,
Yeah.
mental health care. That was a great one. It was amazing. Our panelists were mwah. Yes. Okay. We'll see you next week.
All right. Bye, everyone.